We're often told that palliative care these days is extremely effective, but more often than not you hear people saying that their pets died in a more civilised way than their relatives. Palliative care still isn't working, is it?
Well, I've had patients say that to me, and I think that's a reflection of the fact that there are still people, many people, who die bad deaths in terms of uncontrolled pain, other symptoms, without the appropriate care for them or their families. And that needs to be acknowledged as both a tragedy and a scandal in our society today. The tragedy is that needn't be the case, that we have the most sophisticated palliative care services in the world. This country was a pioneer in that field, but the truth is that those services are still very patchy in terms of their provision across the country, and there are many healthcare professionals, both in hospitals and in primary care, who lack appropriate training in symptom control, and in particular in the use of strong painkillers and other sedative drugs, which are very important at the end of life.
The fact is, palliative care doesn't always offer all the answers. For many people, the issues are not about pain predominantly. They're about lack of control, the loss of dignity, the fact that they're going to become totally dependent. And at that point, they make a decision that they want to end their life. And you have no right to deny that.
Well, in terms of denying them the right, that is an issue for society. My fear at the moment is that this country is going down, or risks going down, the route of assisted dying with its eyes closed, really. If you ask the public opinion, the majority are in favour of a change in the law, and I think the reasons for that we've already discussed, that it's largely through personal anecdote, personal experience of loved ones who've died badly. But I think it's very important that we step back from that emotional gut reaction and look at the arguments and look at the consequences, really, for our society if we take that step.
What are the consequences that you're concerned about if this bill should be passed?
Well, my main concerns are the risks that it poses to the vulnerable. We know already that those who are sick, those who are elderly, those who face terminal illness already feel a burden. And if the option to end their lives quickly and easily were there, how many would take that route who would otherwise not?
Doctors are often accused of being patronising, and I think it could be described as a rather patronising view to suggest that these adults are not competent to make up their own minds.
Well, I think my experience in palliative care has been that people's minds will often change, that actually those sorts of feelings are motivated by fear, as we said, fear of dependency, fear of loss of control, fear of symptoms. And when you come alongside people and value them for who they are and give the appropriate support, people very often change their minds and will be able to find some sense of meaning, some sense of value over the time they have left. I remember very clearly one lady who came to us in the hospice, very, very frightened, very low emotionally. She'd experienced a lot of pain for some time, and really she wanted her life to end. And she said on several occasions that if she'd had the option to do that, she would have done. But over the 2 or 3 weeks that she was with us, having experienced the care provided in the hospice, we saw very gradually a transformation in her. And although we didn't completely control her pain, she still had some pain. We were able to partially relieve it. But more importantly, we gave her the resources with which to cope with it and to go on living. And she came out of the hospice full of gratitude, full of praise, really, and deeply thankful that she hadn't had the option of ending her life quickly, because she now saw that whatever time was left, albeit perhaps quite short, was meaningful to both her and her family.
As a palliative care specialist, have you often had patients pleading with you to end their lives?
I wouldn't say I've had it happen often. I've often had patients express a wish that things would perhaps hurry up, that they're struggling to go on. I think those sorts of requests, expressions are very complex, and they're really used as a vehicle to explore the distress that's going on underneath. when you actually come alongside people and meet some of their needs, there are very few, I have to say, very, very few, who persist in a reasoned request to want to die.
What difference would it make to you as a palliative care doctor if this bill is passed?
I think it would do tremendous damage to the care that we're able to provide, really. I think once you cross that line, you break a trust between doctor and patient, which would be very hard to rebuild. And I think it would make my job a lot harder in that those sorts of issues would not come to the surface. People would be afraid and much more reluctant to express their distress, their fears, if they thought that actually I might then suggest that they took the easy way out.